Well, let's get to the panelists. I'm going to do just brief introductions. Ken Powell is Chairman and CEO of General Mills. Scott Portnoy leads the Cargo Food Ingredients and Systems platform. Jack Larson is CEO of United Healthcare, Medicare, and Retirement, one of the businesses of United Health Group. And Pete Lawyer is Senior Partner and Managing Director of the Boston Consulting Group's Minneapolis office. So Mr. Powell, I'd like to start with you. How does General Mills utilize its business expertise to fight hunger in Minnesota and elsewhere?
Yeah, so thanks for the question. The unique role that business can play. First of all, before I talk about some of the things that we've done, one of the things that we've learned is that our employees really want us to engage in this way. And when we find ways to connect these problems and these challenges directly to our employees, it's very, very powerful. And in fact, some of them tell us that the work that they've done, supporting Hunger-Free Minnesota or some of our other hunger initiatives is the most gratifying work of their career. So we enable our employees to live their values while they're at the workplace, and it's really powerful. So a couple of examples. Hunger-Free Minnesota, one of the key pillars of this initiative is improving access to existing programs. And one of the key programs is the SNAP program, which is Supplemental Nutrition Assistance, which is a federal, it's everywhere. The problem is that it's underutilized. And so we had a team of marketeers here at General Mills who put their hand up and said, we'd like to help. We think we can figure that out. And they went out and talked to all the potential clients of SNAP and gained a deep understanding of why wouldn't you apply for this program. And they found out that a lot of people simply didn't know about it. Some people thought, oh, these things are so complicated, I'll never be able to, it's just not worth the effort. Some of them were embarrassed to use a program like this. Many of these people, by the way, were elderly. And so this is basic marketing consumer insight. They learned about the potential users of this program. They developed a communication program which we put on air, and over 3 or 4 months, I think we gained 50 or 60,000 new enrollees in this program simply by having marketing experts here at General Mills help with the consumer insight and the advertising. One other example, very briefly, outside of Minnesota, we have the hunger in the world is in Africa primarily. 900 million, 1 billion people food insecure in Africa. General Mills doesn't have a big footprint there, but we really want to help, and we feel we should help. And so 4 years ago, we created a partnership, again, that word partner that you're going to hear so often today, called Partners in Food Solutions. And what we do through this program is we transfer our technology to small and medium-sized, emerging food companies in Africa, in Kenya, Tanzania, Zambia, Malawi, and we just opened up Ethiopia. So we've mapped the food sector there. We know who the small companies are. We're transferring basic technology to them around extrusion and packaging and nutrition and formulation, and we're helping them succeed. We're helping them grow. The real prize in all of this is these are local companies, and they're sourcing from local farmers in Africa. So the impact on economic development in the food chain is very profound. So anyway, there are many ways that businesses can bring their unique expertise to this problem. Chris.
So Mr. Portnoy, you're next. And what attracted Hunger-Free Minnesota to Cargill, and why did you decide to invest in this effort?
Well, like Ken just mentioned, it's some of the same reasons, actually. For our employees, we're a food company, and food security, whether it's in the state of Minnesota or whether it's around the world, is an important part of what we do. We do it in many different ways, and so for us, when we had the chance to work with an innovative approach to providing food security in the state of Minnesota, we were immediately attracted to the notion that maybe we could make a difference. Maybe we could help in some way through innovation and through some of the methods that we've used around the world, close the meal gap that exists in the state as well. And so we have a lot of employees who were engaged in the subject and engaged in really the emotional aspect of helping close this hunger gap this meal gap that exists in the state of Minnesota. So it was a natural for us. It really was.
So Mr. Larson, I'm always very, very happy to read that Minnesota is one of the healthiest states in the nation. So my question to you is, how does health and hunger, intersect, particularly when you're thinking about Minnesota?
Health and hunger are just in our collective corporate minds, absolutely at the perfect intersection. We have done quite a bit of analytics around this, and there's certainly quite a bit of work in the public domain. And when you look at the issues that come from food insecurity, poor nutritional habits, sometimes lack of access to nutritional food, it really is the root cause of so many of our healthcare challenges today. Certainly we can read about the pervasiveness of obesity. Sort of perversely, poor nutrition is at the root of many of the obesity issues we have as a country. You step off of there from obesity to hypertension, heart disease. Poor nutrition in children leads to a lack of healthy births in this country. It is so root to the health issues, and as a company whose mission is helping people live healthier lives, how could we not become involved in hunger in this country? So just as my colleague said, it was just an absolute natural for us.
Mr. Lawyer, so now, how do you frame that discussion, that issue?
Well, I think I would start by saying, we're sitting here in the heartland of the most prosperous country the world has ever known, and yet there's hunger in our midst. And we look at that situation, the irony is just astounding, and we have the ability to measure it. We have the ability to figure out what we need to do to change it. So the simple answer is let's get about the business of doing that. Now we're a $4 billion global strategy consulting firm, and to the extent any of you have heard about consultants, you've probably heard people say they're the folks who ask to borrow your watch to tell you what time it is, and then they charge you a fee for that. There's an even less flattering one involving seagulls and guano, but we don't need to go there. The truth of the matter is we do like our analysis, and today you'll see a little bit more of that with my colleague Dan Gott presenting some of the analysis from the community close-up. But that sort of thing has a purpose for us. We're trying to get to insight on behalf of our clients. And so on behalf of Second Harvest and then Hunger-Free Minnesota, we've done really three things. One, Ken mentioned the SNAP program. We came in and helped to identify what were some of the challenges with SNAP participation in Minnesota, which at the time was the 7th worst participation rate in the nation, even though this is funded at the federal level basically by your income taxes. So we're getting less than we put into that program, so heavily underutilized. The second thing we did was we worked with a broad coalition to put together the business plan for Hunger-Free Minnesota. And really that involved looking at the aggregate level to say, what is the total demand out there in the sense of unmet food needs, and we were able to quantify that in terms of missing meals, and then say what kind of supply could we get to bridge that gap. But that was very much at the aggregate level. So the next step was really to bring that down into what you'll see this morning, the community close-up involvement, and really that's trying to figure out, for all of those folks who are food insecure, where do they live? How do you actually match up that aggregate food supply with the individual needs that those folks have? As Ken mentioned, and Scott and Jack backed up, this is very energizing for the people in our firm who get to work on it. It is something that they feel very strongly about, and we're just delighted to have the opportunity to give them that outlet and to do something for the benefit of the community that we live in.
Mr. Portnoy, what role do you see farmers, the agricultural industry, have in terms of hunger in Minnesota?
That's a great question. I think that one of the things that we might not realize is that, in fact, we produce enough food in the state of Minnesota. It's a matter of making sure that we don't waste the food that is produced. So one example was last fall. There was actually a surplus of sweet corn, about 600,000 pounds of sweet corn that literally was going to go to waste and rot because it has a very short shelf life if there was not a method to get this sweet corn to market as quickly as possible, right? So what happened was this public-private partnership that is part of Hunger-Free Minnesota got together and put some creative thinking behind what to do with this surplus. It was a very quick opportunity And Seneca Foods organized the transportation of the sweet corn to our facilities, Cargill's facilities in Savage. We brought a group of volunteers to pack the sweet corn on an immediate basis. We had Super Value with their refrigerated trucks there simultaneously. Once the packing was done, put it on the trucks and then got it to the food banks so that the surplus could be used rather than spoiled.
So the adrenaline was really was rushing on this one.
It was. It was
But it was
really
a learning
exciting.
experience?
It was, and an example of, and that happens all the time. This was just one example, right? So that happens all the time. And so if we can, search and reapply, if we can replicate these kinds of innovative solutions when they exist with our farm population in the state of Minnesota, we can help solve a lot of the issues that we're struggling with in terms of hunger in the state.
Mr.
Can I
Pallot?
jump in?
Oh, sure, please.
Chris, or- well, I mean, just to add, well, first of all, this wouldn't have happened without Cargill, and so it shows the power of partnerships here, and different people have different takes and different understanding of the value chain, and these guys, saw that and jumped on it, and we all benefited from it. But I think there are something like 30 million tons of food that goes into food waste every year, which is more than enough to address the hunger issue. And so it's an incredible waste of food. Food also sits in landfills and is a huge generator of greenhouse gas. So there's all kinds of benefits to focusing on this food waste issue, and we're just, I think, seeing the tip of the iceberg here as we get into this.
So let me follow up with this. So it's a stunning number, 600,000 people in Minnesota are hungry. So expanding what you were saying, what do you see as the role of the private sector in addressing hunger?
Yeah, well, I mean, I think we've demonstrated clearly with this program that the role is very, very significant, and we can do it because of the different views that we have of the whole supply chain. I think we can do it quickly and more efficiently and more creatively than other institutions can. And frankly, by the way, if we can't do it in Minnesota, I don't know where we can, because of the you mentioned you saw every farm on the way up to. But look at the companies that we have here: Cargill, General Mills, Land O'Lakes. We have Super Value. Hormel. I mean, so we have a concentration of food companies. We have fabulous health experts, as we've heard from United Health Group. We have knowledge partners like BCG, and others who are willing to step in and provide kind of the analytical, framework that you need to really think about these in the right way. So I think we've demonstrated that business, can and is playing a huge role in doing this in a very efficient way.
Beyond just the efficiency, the ability to, in very short notice, call on highly engaged employees to be where we need them, doing what needs to be done, and without a lot of muss and fuss. It's a wonderful thing.
Well, speaking of highly engaged employees, I mean, probably at least most of you, many of you, some of you in this audience, have known what hunger is like at some point in their life, and it hurts. So thinking about hunger and health, how, in terms of, what can your employees, what can United Healthcare do on the health aspect when we're thinking about hunger?
We talked about Minnesota, and I find it just breathtaking that there's several 100,000 hungry people in the state for all the reasons.
600,000. I mean, it's
600,000.
a real number.
It's remarkable. At United, we're envious and jealous, I guess, of the tenure of Cargill and the nifty brand that your company has, Ken. We're a relatively young company. We're maturing, and I think we are maturing in realizing the role that our 130,000 people need to play in the communities where we work and where we live. And I think that's been eye-opening for us in the last 5 to 7 years. And we've chosen to focus on really 3 areas where we can help. One is certainly giving. In many ways, that's the easiest, perhaps the most needed, but it's the easiest. The other one is volunteering, and I think we have done a very good job in a variety of cities, in a variety of settings, helping a variety of individuals and groups and communities. And the other thing I think that we can do, perhaps uniquely, is sharing our innovations around data. What works, what doesn't. Where in that food chain, that value chain, are the breaks? And we have a lot of very smart people who monitor the health of several millions of Americans and try and relate it to underlying cause. And as I said earlier, time and again, food comes up. Food and nutrition comes up as root to so many things. So I think corporate America and United in particular can help in some very critical ways.
Yeah, and Mr. Portnoy, in terms of Cargill, I mean, you gave a great example, but describe a little more about how Cargill is supporting Hunger-Free Minnesota.
Well, for us, it really comes down to certainly financial support. I think that's a very critical part of it. It's also part of the food bank system. We have a lot of volunteers who actually work for the various food banks, a lot of retirees actually who derive a lot of personal satisfaction and emotional satisfaction out of working for Second Harvest Heartland or some of the other food bank opportunities that exist here in the Twin Cities. And also I think the other thing that we see is because we have this experience of working with food security issues around the globe, I think we see an opportunity to take some of our learnings that we have in the state of Minnesota and reapply them outside of the state of Minnesota as well as around the world. And so part of this is the learning that we get from our effort here in the state of Minnesota and in recovering some of these agricultural surpluses, as Ken was saying. I mean, it's not just in sweet corn. I mean, Minnesota produces a lot of other fruits and vegetables that are perishable. And so there's a real chance for us to replicate the example that I gave just a few minutes ago in other crops as well. So I think it's all of those things that cause us to be committed and excited about supporting Hunger-Free Minnesota.
Mr. Loy, I think one of the things that upsets a lot of people when it comes to thinking about hunger are children. And again, there's a certain power to numbers. You were talking about data, the power to data. 212,000 children live with food insecurity. Quite simply, okay, this is not acceptable. How do we address this?
Right. No, it's an excellent question. So, you wearing a watch?
No. I turned off my cell phone.
All right. So I won't ask you if I can borrow your watch, but approximately it's...
If you want to be Clint Eastwood, you can borrow my chair.
Yeah. No, but it's about 9:40. It's a Thursday morning, and that's actually a really good thing for the 212,000 kids in Minnesota who are food insecure, because many of those are school-age kids. And they had an excellent chance, to the extent their school was open today, they had an excellent chance of participating in a school breakfast program. They have an even better chance of participating in a school lunch program, and many of them are enrolled in an after-school snack program. And one of the things that we found about it, in fact, I think one of the surprises, I think, from the analysis was we have very good enrollment in those programs. The participation rate is actually quite low. So only about 60% of kids who are eligible for the school lunch programs are actually participating. For school breakfast, it's about 33%. These are definitely problems. But I think those problems are solvable. You have such a clear channel, such an obvious way to reach those kids. That we need to figure out ways to improve the delivery, to reduce some of the stigma associated with it, to frankly engage kids in participating in meal programs where they're healthy foods. So maybe they're not as attracted to some of those foods, but we've got to get them participating more fully. But that's it's actually a little less than half the problem. To us, the biggest surprise was actually that most of the problem with hunger in children occurs during school holidays, it occurs during weekends, and it occurs during the summer. And at those times, if you have about 23 million missing meals for kids, it's really those points in time where we've got to find a way to deliver food more effectively to children. Now, we tend to define the issue of food insecurity in terms of 4 broad cohorts, right? So we've got an elderly population, We've got long-term unemployed that tends to have a very high degree of overlap with disability. We've got the working poor, and then the last category is families with children. And the good news is that families with children actually participate at a very, very high rate in the SNAP program. So we're getting to them, and as Ken mentioned, that participation rate is improving, and that's one of the primary vehicles that we have for reaching children. But we still need to find ways to break down those barriers, reduce the amount of stigma associated with various food programs, because frankly they're our most vulnerable population, and we simply need to do a better job on their behalf because we have the power, we've got the food to do it.
So, Mr. Larson, there are a number of seniors that also, going to the other end of the spectrum, who are dealing with hunger. And so, what are some of your thoughts about dealing, with seniors, with this aging population, and dealing with hunger?
Well, I appreciate the question on seniors, partly because that is the part of the business that I look after on behalf of United, but partly because I'm fast approaching that senior status eventually.
You find yourself asking, where did the time go?
Where did it go? It's really interesting. In this country today, there's probably 9 million-ish or so people over the age of 50 who are at risk for some form of food insecurity, and it's the fastest growing subsegment of those at risk of hunger. I think, kind of in healthcare, as I'm sure it is in assisting in various food assistance programs, logistics is really a challenge. Oftentimes with a senior population, there are communications issues, there are the pride issues that you mentioned earlier. There is this sort of feeling that I can do it myself, I don't need the help, and I had an interesting story told to me by a physician that I know from professionally. And he was saying even within a seniors group, there are various segments that he has to change his approach to. Seniors who are, think about it as 70 years and over, tend to be very compliant. The doctor says, Jack, I want you to take this pill 3 times a day. Jack takes that pill 3 times a day. And then there are the seniors who are maybe new to 65, approaching 65, over 65, and that segment comes fully prepared to debate their illness, talk about the various alternatives, self-prescribe across various sets of prescriptions, all armed with information they have on the internet. It's just a very interesting phenomenon how you deal with older people. But having said that, I go back to while there are challenges in healthcare, making sure seniors get what they need, and challenges in food assistance, programs are out there that exist today, that it's really a question of connecting that need with that program. We've talked about the SNAP program now several times, but here's a program that is in place. We know it works. We can compute the economic magnification effects, $1 in, $20 to $30 of increased economic activity back out, and these programs work. And it's a question of marketing, it's a question of connections, it's a question of communications. In my business, we have to go where seniors are, whether it's in their homes, in long-term care centers or whatever. So I think the challenge is getting to where these folks are and connecting that need with a variety of programs. So I think it works.
Mr. Powell, give me your thoughts at this point in time about Hunger-Free Minnesota in General Mills and this partnership that we're going through.
Well, first of all, I think that this is it is a tremendously unique collaboration, and our belief is that it's going to be, and it reflects, I think, some of the inherent tremendous strengths that we have in this state. Not only the nature of the private sector that we have and the companies that we have here, but also the spirit of engagement and the volunteerism and the willingness of companies across the economic spectrum in Minnesota to get involved and to enable their employees to become involved, and as I said, really live their values by by engaging in this kind of work. And I think we just have an incredible sector that way that is willing to do that. But we're seeing it work. I think, our view is that we've laid the groundwork. We've put a structure in place. We're seeing success. I think today, marks a conversation where we talk about what's next and how do we go forward and how do we use sort of this next generation of tools that will really allow us to micro-target that have been developed by BCG. And so we think we're very encouraged by that. And frankly, that's why, we've been, excited to invest another $1 million. And I think there will be others who will join us in that. So it's unique. It's working. We want to keep the momentum going. I think one of the interesting questions is what would it take to scale this idea? How can we work this
Across the country.
Across the country, and that's I think this has been so effective, and I think it's so promising. That is really a conversation that we should be having, and how can we promote that scalability? I think some of the ingredients, clearly, the state of Minnesota, it's not California, it's not 35 million. It's a manageable region. It's 4 or 5 million people, I think, which is key. I think having a knowledge partner like BCG, being able to really define the problem and bring metrics to it has been absolutely crucial. I think having some of the convening organizations that we have in this state, whether it's the United Way or some of our big corporations, there's leadership becomes critical to bringing all the elements together. So we'll have to think harder about what would it take, but it works really well. There are food companies and food, it's the largest sort of manufacturing employer in the country. So food is a huge and very dispersed industry across the country. So, I think you'd have those partners. But so this whole idea of how to bring everyone together regionally in areas where you can really focus and get your teeth into it will be something that we ought to discuss.
Yeah. Mr. Portnoy?
Yep. Well, I think about the questions that have been asked. I realize that a lot of the remarks that I was going to make have been addressed in the questions. But I think one of the things that has not come out in the discussion so far is this whole notion of collaboration and interdependence. And in terms of a public-private partnership that exists with Hunger Free Minnesota, one of the things that attracted Cargill to looking at solutions that can deal with the food security issues that we have in the state of Minnesota is largely this idea of working across areas, if you will, or segments. And whether it's the nonprofit segment, food banks, whether it's food distribution challenges, whether it's challenges around agricultural practices and ag management practices in order to make sure that we're producing enough and taking it off the farm as quickly as we possibly can. Those are all things that can happen if Cargill was doing this on its own, or if General Mills was doing this on its own, or BCG or United Health. It only happens when you have a collaborative effort with the best thinking going into this from both the nonprofit world as well as from the private sector. And when, even though sometimes people joke about the consulting world, process, data, technology, putting process behind an effort, putting data behind an effort that gives you confidence that you're working on the right things, that the metrics are right, is really important, and that you use the best available technology to be able to deal with the challenges that we face. So I think those are the things that are really exciting about this particular effort, and why I think it's going to have a lot of success. And like Ken, I do think it's really important that we capture the learnings, we capture some of the things that didn't work, and we make sure that we're doing the best job we possibly can to take these learnings and transfer them across the United States, as well as, for that matter, in other parts of the world.
Mr. Larson?
Well, I guess, we've been, as a company, involved with Hunger Free for a year and a half or 2 years or so, and one of the things that appealed to me personally was the analytic approach to a very intractable problem. And I think as a culture at United, we are very fact-based, data-driven, sort of analytical to a fault. And while that may be a weakness, that was exactly what drew us into the hunger-free notion. It was well thought out. It was constructed as I would expect to see any one of our businesses proposing a venture investment or a new business or an acquisition. So it was speaking the right language to us at a time, I think, that we wanted to hear that message. We were looking for something to do, again, in our maturing in our corporate and social responsibility, part of our corporate personality, we were looking for something to do, and this just resonated very well. So apart from the analytics, we also, I think, knew that we wanted to be a part of and be associated with people and a set of initiatives and projects that wasn't going to be something that we felt good about at one time, and walked away and it went away. I think that this notion of what did you say, replicate, or search and replicate?
Search and reapply.
Search and reapply is, I think I may use that today. That's really good. I think it's an extraordinary concept, and I think it's very powerful, and it's something that we felt very strongly about. And as a company, we just couldn't be happier with our affiliation with Hunger Free.
Mr. Lawyer?
So one of the things that I think everybody in this room certainly understands, but when you are all out talking to other folks about Hunger-Free Minnesota and the issue of missing meals, you will face some skepticism from time to time about, we don't see starvation here in the United States, so what is all this nonsense about hungry people? First of all, it is not nonsense, right? People absolutely are skipping meals. But secondly, think about it from this standpoint. There's an economic ladder that you can help people on. Basically, people have very, very different circumstances. There are 600,000 Minnesotans who face some form of food insecurity at any point in the year. And that may be the result of lack of opportunity, lack of education, could be bad luck, it could be bad choices, so let's be honest about that. But we don't really focus on that, and we certainly don't pass judgment on that. Food is a basic need. It's something that we have the ability to help people solve that basic need. And when we do that, they actually can take advantage of that to apply what might be very limited resources toward other things that actually help them improve their economic lot, right? So think of families with children. Very high percentage of those are single-parent households headed by women, typically in a very low-paying job. Now, imagine if they have a car repair bill that's due and their car is stuck at the shop. If they pay that bill, they don't have food to put on the table. That is an excellent use of the emergency food system, right? To go to the food shelf and actually take care of a need for whatever time they need to have that need taken care of, so that this woman can keep her job and keep food on the table for her kids. There may be another situation where you have a laid-off worker who developed skills 20 years ago, and the economy has since moved on. That person needs to go back and get some training, but while that person is getting training, there's no income coming in, and so they need some food assistance during that period of time. These are very real issues. These are the things that cause people to access the type of food programs that we're talking about. And as we've all said a number of times, here in the heartland of the most prosperous nation the world has ever seen, we can solve this problem. So let's take care of that.